welcome to the special edition of The Lead. I'm Pamela Brown, in today for Jake Tapper on this Monday. And we begin with the health lead, the coronavirus pandemic. Today, there is encouraging news. The vast majority of the country is seeing the number of new infections decrease. Hospitalizations are also on the decline. In a little more than a month, hospitalizations have plummeted by 44%. Yet the promise from the Biden administration to reopen schools remains unfulfilled. And as CNN's Jason Carroll reports, new guidance from the CDC is not focused just on the science.
Students may be on vacation today, but mounting confusion and frustration from parents and teachers isn't taking a day off. After the CDC rolled out its new guidelines for reopening schools Friday, which focus on 5 strategies for in-person learning, including universal mask wearing, physical distancing, hand washing, cleaning, and contact tracing. But the CDC also recommended full in-person learning only in places where levels of community transmission are low. The problem, according to a CNN analysis of federal data, almost 90% of American children attend schools in high community spread areas located in so-called red zones.
As that transmission comes down, we'll be able to relax some of these measures.
The issue has become a political landmine for the Biden administration, trying to get kids back into classrooms while also appeasing teachers' unions and parents in hard-hit areas, many of which have demanded vaccinations and other measures before going back to in-person learning. The CDC director is saying the guidelines changed after holding meetings with parents and teachers.
Direct changes to the guidance were made as a result of them.
Telling Jake Tapper on State of the Union that science is behind all the guidance.
The real point is to make sure that the science is consistent with our guidance, which is consistent to say until we can ensure that we have all those measures happening, that the schools wouldn't be safe.
This as health experts express cautious optimism as coronavirus cases and hospitalizations in the country continue to show signs of improvement. Daily cases falling from more than 300,000 in January to less than 100,000 now. However, there's also grave concern over the spread of more variants, 7 different ones already found in the United States.
I'm concerned about these variants because we're not doing enough surveillance, so we don't know how widespread they are.
Despite warnings, this past weekend was one of the busiest for air travel during a pandemic. More than 4 million people have flown since Thursday. States such as Montana have lifted mask mandates, New York now allowing limited indoor dining, while the demand for available vaccines still outweighing the supply.
I know the Biden administration is hard at work at getting states more accurate information about how many vaccines are out there, but it's got to be done real quickly because it's impossible for states to plan.
And Pamela, this late development, the biotech company Novavax says its scientists are working on a new version of its COVID vaccine, one that would specifically target one of those variants, the South African variant. The research is still in the early stages, but if everything pans out, what they're hoping is that new vaccine would serve as a booster to target that specific variant, the South African one. Pamela.
It's a really interesting development. Thank you so much, Jason. We appreciate it. And joining me now is CNN's chief medical correspondent, Dr. Sanjay Gupta. Great to see you, Sanjay, as always.
Hey, Pamela.
The big talker among parents, as you well know, is schools reopening. When is that going to happen? What does the science say? CDC Director Dr. Rochelle Walensky admitted Friday that direct changes to the guidance were made as a result of conversations with teachers and their concerns. Does it seem to you like the CDC is really just trying to please everyone here?
Yeah, I guess in part. I mean, I also think that, you know, what really strikes me, and I've talked to a lot of people over the last couple of weeks about this issue, is that, you know, you could look at the exact same data and come to different sort of conclusions in terms of the strategy going forward based on your tolerance of risk. You know, I think that there's this idea that, like, how much risk are we willing to take when it comes to students, when it comes to teachers and staff as well? And that's in part what drives us. It's not like math, 2 + 2 always equals 4. There's some subjectivity to it. I think what is interesting is that if you look at the overall recommendations, they're going to sound very familiar. It's all the things we've been talking about for a year now, Pamela. But they also make this point, as Jason Carroll was just making, that, you know, the country is essentially on fire right now. There's just too much community spread just about everywhere. Just about every student lives in a community with too much community spread. So in those situations, do you want to aggregate lots of people together, for example, in a school? And what the CDC is saying, probably not. I mean, the numbers will continue to come down, and it'll be easier, but probably not right now.
But in light of what you just said, the science says, from what we know now, that schools are not contributing significantly to the spread of coronavirus. And I know part of that perhaps is because schools aren't open in those communities where they're red hot. But I want to ask you about this study I was just reading about recently, and I interviewed the doctor, one of the doctors who worked on it, that showed transmission of COVID is less in school than outside of school. So is the science then in favor of reopening schools? Could it actually help cut back the cases of COVID?
Yeah, you know, look, and again, this is one of those things where it's so personal, right? I mean, because I have kids that we're making this decision all the time. So here's how we've looked at it, and this is after talking to lots of epidemiologists, is that I think what we can safely say, it is possible to open schools safely and have lower rates of transmission within the school as compared to the community. But what does that mean, possible? What has to happen in order for that to take place? All those mitigation strategies have to be followed to a T, really. So, for example, I don't know if you were talking about the Wisconsin study, Pamela, the researchers you were talking to, but they did find 37% lower transmission in the school versus the community, but they also found 92% mask wearing adherence in that study as well. So if you go around the country, what is mask adherence in schools? Closer to 65%. So, you know, it is possible, but all these things have to work. And there's some school districts that don't have the space to physical distance. They don't have adequate masking. They don't have adequate ventilation. So those are obviously going to be places that may have a much harder time opening safely. But it is possible if you have all the resources.
You have all the resources, and we heard Dr. Walensky talk yesterday to Jake about Jake Tapper, obviously, but about you know, mask breaching and how that's an issue. But I don't know how you guarantee that everyone who goes to these schools is wearing their masks all the time. And she also talked about what you just mentioned, the mitigation aspects, that is needed. Those are needed steps for schools to reopen. They're listed here on the screen, but not everyone is taking those steps, and so therefore the schools stay closed. Do you think that these recommendations are unattainable or unrealistic, as all of these have to be followed in order for schools to be open?
I think it may be challenging to say that every school district in the country can do this. We know certain school districts can, so I don't think it's unattainable in that sense. But, you know, there are school districts that still don't have some of the, you know, just the square footage alone may be a rate limiting step in terms of actually being able to meet these mitigation strategies. I think that's a challenge. And also, you know, mask wearing, I did the story with the NFL last week, Pamela. After all was said and done, the NFL had a 0.08% positivity rate. You asked the chief medical officer, out of all the things you did, what accounted for that? And he said it was absolutely mask wearing. When we got very diligent about it, we saw the numbers plummet. We saw people not becoming newly infected. So can schools do that? Do they have enough masks? Will there be adherence to those mask policies? I think that makes a huge difference. On that list you just showed wasn't testing either. Forget about the vaccines for a second, but testing. There's studies that come out that say if you have regular testing in schools, you can drop infection rates by close to 50%. So I think it can be done safely, but the schools have to have the resources to be able to do it.
Yeah, which is hard for parents to swallow because you want just a simple answer, right? And it's not so simple. You have these 7 mutations as well. I'm just curious, in light of these 7 mutations we're learning about, how much more risky is it to just go out to, say, the grocery store, even if you're masked, than perhaps before these mutations?
I would sort of frame it like this, that we know these mutations now exist. What we still don't know is how widespread they are. I think, you know, part of this gets back to the subjective risk tolerance. I hear about mutations in my area, and I have to now assume that the mutations are fairly widespread and that those strains, those new strains, are more transmissible. So what would have otherwise been a chance sort of, I see somebody quickly and I don't really worry about, a transmission happening. I think those chance sort of encounters that you got away with over the last several months, they become riskier now. So I don't think it means anything different other than be really, really diligent about all the things that we've been talking about. Don't get careless.
Or double mask potentially. I mean, that's also been a topic of discussion. All right, Dr. Sanjay Gupta, as always, thank you so much for sharing your wisdom and expertise with us. We appreciate it.